19th. If I could just have a show of hands if you can see my slides, my screen. Let's see. I don't see any hands. Oh, there we go. Thank you. Okay, great. Well, I appreciate you all joining in once again, and we have an agenda today that, you know, we'd like to discuss some of these things weekly, but I think it's important to touch on some of these things again. Of course, the cutoff date for 3-1 enrollment has come and gone for the most part. Certainly on the FFM, for the most part, enrollment has come and gone for 3-1. There is an extension until the 22nd for on FFM enrollment if the clients, your customers and clients don't currently have insurance, experience a technical glitch, they're not currently on the FFM, they weren't on a 2015 plan that terminated or was canceled for non-payment. So they do have a little bit of time. There's going to be some information in my newsletter about this today, but essentially it's again on the honor system. If you have any stragglers, and I'm sure you do, I would give it a whirl if they need to have FFM coverage or healthcare.gov coverage, and looks like they're going to push that till the 22nd, so a few days left. For the most part, for off exchange, the 3-1 enrollment period has come and gone as well. Highmark and Western Highmark, Aetna, Coventry, Capital Blue Cross, they all, and I'm sorry, Independence Blue Cross, they all stopped taking applications for 3-1 on 2/15, which was Sunday the 15th. If you have a qualifying event or submit an application, at this point you will need a special election form and a qualifying event. Geisinger extended till the 22nd for off exchange. NEPA has always been the 25th for off exchange, and UPMC will be the last day of this month, which is the 28th for off exchange for a 3-1. So there is still some opportunity, but for all intents and purposes, it does appear that 3-1s have come and gone unless your clients fall within those specific parameters. So let's talk a little bit about qualifying events and what they are. How do you get a special election period? Well, they're pretty easy to come by, some of them. You know, if there's a birth or adoption, somebody placed for adoption or in foster care, marriage, any new marriage, that's a qualifying event. Loss of pregnancy-related or medically needy coverage under Medicaid, if they lose their Medicaid coverage, then that's a qualifying event. Loss of minimum essential coverage, if you know they're expiring COBRA, if they become ineligible for Medicaid or CHIP, if their employers terminate employer-sponsored coverage. Voluntarily quitting other insurance is not a qualifying event. If they move to a new area that offers different health plan options, a change in income that would affect their advanced premium tax credit or cost sharing reductions, for this one they already have to be enrolled in a plan. If they become newly eligible for a premium tax credit, if they lose their job or you know, their income tanks significantly that they are now eligible for a tax credit, that's a qualifying event. And of course, the three biggies, the numerous ones that are all essentially based on issues with the FFM and incorrect advice from them. So qualifying events are relatively easy to come by, and I would encourage you that if you do have somebody that calls you, you know, see if they fit within one of these categories. If they do, then you're golden. And I'll leave it at that. How about that? So again, I wanted to remind you about the Highmark authorization forms for the missing national producer numbers. It seems, you know, we're 0 for 2 from last year and this year that at the beginning of the enrollment period, the 834 reporting that went from the FFM to the carriers somehow dropped some of the national producer numbers. The difficult part is that commissions are so delayed that you don't really even know if you are missing or one of your clients is missing until really after the fact. Highmark and NEPA have implemented, as we talked about before, a 90-day rule from their effective date that you have to identify that you are not hooked into that case and take the steps to claim those cases through the broker authorization form. We are expecting a data feed from Highmark for Western and Central at the beginning of March. So it's going to be really important for all of you to check those March statements. And if you have a January 1 case that is not showing up, you need to get in touch with your case managers and verify that Highmark has the cases and that you are hooked into that case. Otherwise, if you find out that they're not, you're going to have to get that authorization form in before the end of the month so that you can adhere to that 90-day rule. It's a lot of hard work for all of you guys, and I don't want you to, have these cases slip through the cracks and not get compensation. There's the Anthem Breach situation that continues to go on. There's more information that will be included in my newsletter, but essentially all of the carriers, all of the Blues carriers are evaluating who may have been exposed or subject to the breach, and they're going to be notifying each of these people if there is a danger of their information being obtained. So just be mindful of that. A lot of information flying around about it. So, we personally here at URL are insured by a Blues program, and we've, knock on wood, to date have not received anything. So if you do hear of anyone, any of your clients receiving a letter or notification, I'd be interested in finding out about that if you could just let me know. But at this point, I think, at least for the most part, maybe no news is good news. So last week we talked about the CHIP buy-ins, and we talked about that we talked about two things. Last week I said that anyone with low-cost or at-cost CHIP was going to be receiving letters saying that their plans did not meet minimum essential coverage. Well, that was incorrect. It was only the full-cost CHIP people, CHIP children, that were being affected. So as fast as we received clarification on that, we also received notification from the Pennsylvania Insurance Department that Governor Wolf negotiated with HHS and is allowing the coverage to be considered as meeting minimum essential coverage, and that they're working with the carriers and HHS to, to bring these plans to compliance somehow. But it does seem that the letters that were received giving a 4/15 cutoff date for their CHIP eligibility at cost, full cost, is really no longer an issue. And if you have a client that was affected by this and you move to a carrier outside of the CHIP program, they are allowing you to notify CHIP and go back to CHIP. So hopefully we caught it early enough and the governor changed things early enough that it didn't affect too many people. But again, that information is in the newsletter as well. A couple weeks back, we talked about Highmark, Western Highmark Blue Cross Blue Shield, and UPMC giving a courtesy pass for the first claim for a non-par provider. That was recalled, and we've to date not received any additional information on if this option is going to be available, if this courtesy pass is going to be available. So I wanted to just bring you up to date on that to let you know that things change. My comment here, heads are spinning. It just seems like a lot of starts and stops with information and then changing information. This is one of them. As soon as I hear anything on any sort of courtesy pass or concession given to the Highmark folks when they use UPMC or out-of-network providers, I will pass that on. Another change that we talked about was Healthy PA and how Governor Wolf sent a letter to HHS essentially notifying them that we were dissolving the Healthy PA, which is the Governor Corbett's expansion of Medicaid in what I feel is personally feel is a fiscally responsible manner. So these people that are making application or had made application and covered with Healthy PA are going to be receiving letters. It does seem that June is the date that everyone insured with Healthy PA will make the transition to the traditional Medicaid program. The federal poverty level percentages that's not been changed. It's really just what plans are available. So if you have a client today that is up to 133-138% of the FPL, the only option for them is to apply within the traditional Medicaid program. Again, the same income parameters are available and applicable, but there is no longer an option to make application with Healthy PA. And just to say it one more time, the people that are currently insured on Healthy PA, they're not losing coverage. They're going to transition to a different type of coverage, which is the traditional Medicaid coverage that's been in place for years. So, you know, I just thought that was important to let you know if you have clients affected by that transition. I encourage you again, as I have the last several weeks, to use that FFM upload link. It's pretty important for us to be aware of your FFM cases so we can start checking on statuses and, most importantly, checking to see if you are attached to that application so you can take the proper measures, if you're not, to get them under your umbrella, if you will. So, again, that's on our website on the Health Plan Options link under the FFM links and forms. We also put in fact, I'll show you, we also put in the shop information, the agent broker user guide, the billing and payment system user guide, employee and employer user guide. So all of those now are located under Health Plan Options tab, product information, and under the federally facilitated marketplace forms and links. This is also where you'll find your upload submitted applications. You know, again, I know it's a lot of extra work. We're all tired and run ragged, but it's very important for us to be aware of these cases. So that's pretty much it for the agenda today, except for this next to last bullet point before we get to the open forum. You know, I can't say it enough how much I appreciate your partnership and the business that you have chosen to submit with URL. The submission is not done. We expect to have quite a few enrollments coming through for the special election period. We're here to help you, as we always have been, but I would be remiss if I didn't just, again, reiterate how important you guys are to us and how much we appreciate the business that you've submitted to us. So thank you and thank you. Another note is that next Thursday, we will not have a webinar. I am actually going with a couple other members of the PAHU, Pennsylvania Association of Health Underwriters, to meet with the acting Pennsylvania Insurance Commissioner, Teresa Miller. So that's going to be pretty interesting to see where she stands, maybe try to get a feel for you know, what she thinks we're going to do as far as the state exchange. I know that's their goal, but I'm curious to find out kind of what direction they feel they're going to be taking. Anything that I find out, I will absolutely pass on to you in the following webinar, which will be the following week, Thursday, March 5th. So with that, we'll open it up for questions, and not sure if we have a lot. Everybody's probably just too tired. Oh, surprisingly we do. So let's see here. Jay says, as I understand it, on-exchange stragglers will only be able to enroll by phone with healthcare.gov call takers. Did I not read that email from healthcare.gov? Oh, he's asking if Jay's saying, didn't I read this in the email? This, I would then mean that there will be no broker credit for helping with clients to enroll. No, that's not true. Even if you call in, as long as your client gives them your NPN number and name, they have to put that in. Whether they do that or not is another story. That's why it's always best to do a conference call. But yes, I do believe they do have to call in, Jay. You're absolutely right. Jay also goes on to say how much he appreciates Judy Reed, who is one of my case managers, a hardworking lady that she is, and she's done, according to Jay, which we all know, a great job of following up, and he said that to date he's hooked up with all of the cases he submitted. So that's good, and thank you so much to Judy Reed and Jessica Kyer and Elise Fry for all of their hard work through all of this, as well as Stacy Reed, who is our, fingers on the ground, our data entry team. She's entered all of these apps. So, thank you all to them as well. Tim says that he has a client that was not eligible for application via FFM because of low income. If that person gets denied by Medicaid, she can then apply off-market with the SEP. Yes, she can, Tim. And Nate says, why is there this issue with CHIP? Isn't the coverage the same regardless of cost? It is, but I think cost is where it comes in. Maybe cost and also, the actuarial value. Maybe it doesn't fit into one of the metal levels, namely at the 60% level. We're all kind of baffled by it as well, Nate, so I'm not sure what the reasoning is, but it does seem that that's over and done with, at least for the time being. So with that brings all of the questions to an end. Again, next week we won't be revisiting, but the following week, March 5th, we will. And I'll hope to have a pretty good update of my meeting with the acting commissioner. Again, thank you so much, and stay warm. Have a great remainder of the week, and enjoy yourself. Thanks again. Bye-bye.